Welcome to AUA Leadership in Business, an official podcast of the American Urological Association.
Welcome to the AUA Leadership in Business podcast, where urologic professionals experience the practical application of business acumen essential for success in today's dynamic professional landscape. I'm Dr. Jennifer Miles-Thomas, and in today's episode, we will discuss Innovating for Impact, a urologist's journey to transfer patient care. Joining me today for this discussion is Dr. Fenwa Milhouse. Dr. Milhouse is a board-certified urologist and fellowship-trained in female pelvic medicine and reconstructive surgery. Dr. Milhouse completed her urology residence at the University of Chicago and went on to complete a fellowship in female urology, neurourology, and pelvic floor reconstruction surgery under Steven Siegel. After fellowship, she joined the largest private practice group in Illinois as the premier female pelvic surgeon. In 2023, she co-founded and opened an independent practice called Down There Urology in Chicago, focusing on sexual medicine, pelvic floor conditions, and cosmetic genital procedures. Also in 2023, Dr. Milhouse became the star of the TLC Network's Dr. Down Below, America's first medical reality TV show featuring a urologist. She's also currently on staff at Northwestern Memorial Hospital here in Chicago. Welcome, Dr. Milhouse.
Thank you, Dr. Miles-Thomas. It's a pleasure to be here.
It's really great to have you and talk about this. Not everyone kind of works and thinks outside of the box. So I really want to hear about your journey, kind of what pushed you to leave the traditional practice and really start your own. You've done a lot that most of us have never done. So can you talk about your journey and what made you transition into your own kind of practice situation and make it work for you?
Yeah, 2022, 2023 was a crazy busy year.
Okay.
Listening to you say that, all the things 2023, 2023, I was like, how did I get through that? It was a lot. So I, worked for a huge private practice / corporate medicine practice in the Chicagoland area, was very professionally satisfied, was doing good work there, treating lots and lots of patients. And as things go, started to feel the burnout of just the day-to-day seeing patients every 10 to 15 minutes. Some of the joy of medicine was fading, being inundated with the administrative burden. That's its own 30-minute or 60-minute show. And the growing loss of autonomy as medicine does grow. We, as physicians, can lose some of that autonomy and that creative freedom. And as this was happening, I was starting to find myself, if you will, creatively, and have a bigger voice that was reaching patients, that was having an impact in outside of the clinic through my social media. And it was taking me places that I never even imagined it could take me. And that was truly organic. The opportunity that led me to have the TLC Doctor Down Below came completely organically. I did not seek it out. It was not my intention to be, I want to be on social media so I can be famous. It was pure or organic, somebody finding and saying, we love your presence. We think you have something to say and show the world. And we would like to do this on this cute little reality TV show. And so I started to see how I was developing myself into a brand for the first time and thinking of myself as a brand. And I liked that. And I had ideas and I had visions and I had this, again, creative drive. And it became where those worlds didn't mesh. My former employer and my creative, visions just were not in alignment with the, together. And the aha moment really became the opportunity for this TLC show that was not supported by my former employer for whatever reasons that they had. And for me, it was okay, I didn't become a doctor to be on TV. I certainly don't believe that TV is like but it wasn't like, oh, I want to be on TV, but like, what does this mean about me as a brand and like the way I want to reach and be an outspoken advocate for patients and a urologist? And can I see myself continuing on here and being supported here? And I just felt like for me, it was time to go. And at that point, I said, okay, well, where will I go? And it was in that moment that I was like, I thought of, well, why don't I just do it myself? Which was never something I thought about before. And that was very scary to think about that as a next step. Like, oh, let's create our own thing, Fenwa. And that took a lot of a prayer of a lot of like thoughtfulness, a lot of talking to mentors and talking to myself, and really a mindset change.
So that makes complete sense. But what I'm hearing you say is like you really got to a point where you needed to make a pivot. Like you were trying to fulfill your whole self, right? Just personally, how you felt you wanted to interact with patients that were yours, people who were out just in the social media world. And I hear you saying that you recognize that even though you were a physician, that there were many different ways you could deliver the care. And that's really an outside of the box. I mean, all of us are pretty conservative, traditional. We are in this field that technically talks about issues and topics that are not something that's frequently commented back about in public. But that was still a huge leap. I mean, were you very vulnerable? I mean, you basically have a secure job, you're doing very well, you're super busy, and now you're going to pivot to something that no one else is doing. Kind of, can you
Mhm.
talk about, because I know a lot of us are saying, okay, is this it? Is this what we want to do? Things are getting more difficult. Patients are changing.
Mhm.
The the administrative burden is there, but you took a huge leap. You really did.
Yes. And you're right. I was doing well. I was working in an environment where I was happy with my patients. I respected my colleagues. My colleagues respected me. I was booked and busy, and I was doing the procedures I wanted to do. Um, but it wasn't enough because this thing that started as an outlet became a passion. This passion to speak to a larger audience, to um, provide medicine in a way that was outside of the clinical walls, to be a voice of representation, and to do all of this authentically. Okay. And that became critically important for me. And it was making a difference. I was seeing patients in my office saying, "Oh wow, now I follow you, and I feel like you are speaking to me. I feel heard, I feel seen." And it became something that I was eager and longing to do in an authentic manner. And it didn't quite align with the way traditional medicine is. And like you said, we still are a fairly conservative specialty, a fairly conservative institution. Medicine is. And so, in the traditional sense, it was not in alignment. Um, and I had to take a leap. I said to myself, okay, um, let's say I do this and it fails, right? I still can go back. I'm still got these skills. I'm a urologist. I did the hard work. These skills that I, have aren't going nowhere. There's there's a physician shortage. So it's not like I'm not going to have employment opportunities. It became a decision. If I don't do this now, I'm won't do this ever, because in another 10 years or more, I just might be kind of tired. And let me take a risk on me now. It was a calculated risk that was worth the taking for me.
Well, congratulations. You made the leap and you're definitely doing well. I think it's important for all of us to hear your story, because as we're talking about fatigue and burnout and wondering what's next, and the fact that you looked around and said, what else is there? What else can I do? There are many ways to deliver care. Let me find another way. So can you kind of talk about what were your first steps? Like when you decided, hey, I'm going to do something different, what did you do? How did you start your own practice?
Like I said, I prayed, I cried. I mean, I literally did cry. I was like, oh my God, I don't know what I'm doing. I can't. I didn't go to business school. I went to medical school. Like I did not, I'm an immigrant too. I'm saying this story because as an immigrant, the American dream is you bring your children here, they go to school, they attain a good education, they make you proud, especially as a Nigerian immigrant. They make you proud by becoming a doctor, lawyer, engineer, and they become a respected person in their community. And I had achieved that, right? And so I had never thought of myself as like my own boss, truly. I didn't. It wasn't something I had grown up seeing too. And so I really had to find examples of that. And I started to, once I had a vision of like, well, this is the practice my dream practice that I would want to create. I had to find examples of people trying to do it or people creating their, doing things outside the box. So I had to find my tribe. And I spoke to a few colleagues that were out there doing it at the same time. Shout out to Dr. Chanel Wilson. Shout out to Dr. Rachel Rubin. Shout out to Joe Pizzona. I also spoke to mentors that I trusted. Shout out to Dr. Steven Siegel. Shout out to Dr. Greg Bales. I'm just shouting these people out because they gave me encouragement and they calmed my fears. I found a group led by the Dr. Una called Entre MD, and I signed up for a year-long course on basically being an entrepreneurial physician. Again, I did not go to business school. I don't have a business degree, but I learned that you can do these things. We surgeons, we doctors have done the hardest thing that most people will do, becoming a doctor, becoming a surgeon. And so once I figured that, okay, if I could do that, I can learn this. And then I did the essentials. I, found companies like physician practice specialists that help with the steps. Like, okay, you want to start a practice. Here are the steps. There's 1 million steps, by the way. No lie, there's 1 million steps. Here are the steps from 1 to 1 million. We're here to help you, right? Once I found decided on a name, and I didn't do this alone. I did go into business with somebody. So myself and my partner, Dr. Jugan Kansal, the other half of Down There Urology, once we found a name, created an LLC, then we had to do the 1 million steps to actually be a legit practice. Credentialing and licensing and this and that and the other. There are companies that help you do this. You do not have to do all of this alone. I listen to good podcasts. There are podcasts out there. And then I reached out and then I built my network of referrals because, okay, I'm going to open my doors. Where are my patients going to be? And so I spent a lot of time talking to individual gynecology groups in and around where my practice was. Especially independent gynecology groups, independent primary care providers. And they needed somebody like me, okay? Because urologists, it's hard to get in to see a urologist. You know this. And so they're like, oh, great, another urologist in town. Great, perfect. I went and I spoke and I went to every sex therapist within Chicago and I, introduced myself. I went to a sex therapy open house where tons of sex therapists in the room. And I was, myself and Dr. Cancel were the only physicians. I sought out physicists. I went to local gyms. I had a table at a local gym and be like, Down There Urology, this is what we're doing. Med spas, I was there hustling and bustling to get, in the door.
So that makes complete sense. And I think it's something that we've not done before, right? Because as physicians, it's always been okay, you show up and we know there's more than enough patients. So we never really learned the business strategies about marketing and how to find your customer and market fit. And those are the things, yeah, you learn in business school, but you just learn them in the real world. It's like, who am I looking for and
Mhm.
where are they going to be and make sure I put myself where they are. So strong work. So one of the
Thank
things I would
you.
ask,
It's hard.
it's an everyday thing.
It
So
is.
as you're actually like bringing patients in and seeing them now, how would you say your relationship changed? I mean, are there things you offer now or do you have different conversations? Tell me what it's like now that you have your own practice and you're doing things differently.
Yeah, I mean, I've always been a people person. I've always tried to relate to my patients and not simply just be like a proceduralist or somebody who's writing a prescription. I always try to, make the most out of even if it's a 10, 15-minute visit and connect with my patients. I've always tried to be, authentic, comfortable environment. But now I just have a lot more time to do it. I created a practice, you know, and when I with my new practice, I want to have the time to spend with patients. And so I've carved out more time, and with more time with patients means I can really connect more with them, build more trust. I can provide them more. The biggest thing is now I provide a more holistic treatment plan. You know, Simply put, I didn't have the time to talk about sex therapy and using toys and erotica for my sexual dysfunction patients. And oh, talk just all these things that factor into a lot of the things that I treat, these non procedures or medicine things that we know that we should be talking to patients about. And I didn't talk to my ED patients about exercise and how cardiovascular exercise can improve their erections. I didn't have the time. And now I have the time to really provide a very holistic treatment plan. And you're right. Now with my practice, I can offer procedures that weren't really offerable, available parts of traditional corporate medicine. I can offer, PRP and shockwave for my erectile dysfunction treatment patients. I can offer things like the O shot for my female patients. I offer aesthetic genital procedures. I do a ton and ton and ton of penis enhancement fillers, which is so much fun and a science as well as an art. I offer hormone therapies for women. I do now do menopause therapy as a urologist. I do obviously testosterone therapy for not only men and women. And so I get to do these new things that I enjoy and that improve my patients' quality of life. And I get to just have a deeper connection with them, with my patients.
Yeah, I think that's one of the things that all of us kind of regret is just time, right? We're all so busy. There's so much
Yeah.
we have to do, and I think that's some of the reasoning too why um, direct primary care, like concierge care, is really taking off in family practice and in internal medicine. It's because you get the time. But
Yes.
we also recognize that, I mean, it's not for everyone. There's a balance, and those are the patients who are seeking you out. So you're not finding them, they're actually finding you, which is
Yeah.
really interesting because as your practice grew, you became even more prominent on social media. Can you kind of go back to like, how did you even decide to do social media? Like, I'm afraid to post anything ever. So how did you start?
See, I wasn't afraid. Yeah. Truly, honestly, like I was like, no one knows a damn about what we do. Like I was like, this was years ago, like 20, I started practice, not started practice, but I was on my own in 2015. And so like by 2017, I was like, no one knows what the hell we do. Like, no, our patients don't know. And a lot of our colleagues outside of urology don't know. And there's a lot of like, misinformation or just lack of knowledge in general. So, and I like to talk, as you have found out. And so I was like, you know what? And I was already on social media privately, But so I wasn't afraid. I wasn't camera shy per se. And I was like, you know what? Let me just start this Dr. Milhouse, and it'll be just urology, and I'll talk about urology, and I'll keep it, cute, and keep it on, straight and on straight and narrow urology. And it really, there are three elements that motivated me then and that continue to be my center when I think about like social media, because honestly it is work. It is a job. Okay, I mean, what started off as a cutesy little thing that I would do here and there, it takes consistency to build a voice and to build a following, and then you create this, I hate to say the word monster, if you will, that you have to feed. And I love my social media, but it is a job. And the things that motivate me to continue doing it are three things. One is, again, just the vast lack of knowledge about down there, about our genitalia, about sex and sexual dysfunction, and about the urinary system, from patient side, from even doctor side. Okay. So like just teaching and educating the public to the stigma around these, right? We as urologists are so used to talking about this. We're very good at talking about this openly. But the rest of the world isn't. I have patients who tell me, like, the things I'm telling you, Dr. Milhouse, no one knows, not even my husband or my wife. Okay. And so trying to create a space where it's like, this stuff doesn't need to be stigmatized. We're going to use the word penis. We're going to use the word vulva. We're going to use the word vagina. These are things that should not be censored. And last but not least, maybe the greatest, was representation. I never saw anybody like me doing what I do until I did. I never envisioned being a urologist. In fact, when I learned about urology and medicine, I crossed it off my list immediately because I Googled it and I didn't see anything that looked like me. And I thought, oh my God, that's for men by men. Why would a Black girl like me want to do that? And then I met a Black woman urologist, and it changed my world. And I mean, I tell that story a million times over, and I feel the same way. I feel like as if the first day when I met and saw Dr. Lanaine Westney, who was my inspiration. And so representation, just being visible, was going to speak to who knows out there, not only future doctors that look like me or who are others, but also the representation for patients, for my patients who want to see themselves in the people who care for them. And I felt actually an obligation to be visible. It became where I felt an obligation, like, here's this light, don't hide it. It should be shown and visible, because what's the visibility that I was afforded inspired me to become who I am. And I love being a urologist. I love what we do. And wow, wouldn't that be great if I could be that for somebody, one person? And so those are the three things that continue to motivate me to do social media. That's what made me started. It wasn't out of selfish gain or financial fame, but those things. And those are the things that keep me still passionate about it. Now, on top of that, I have a practice. So yes, there's a little bit of a fourth motivation now, right? Like, I need people to know I exist. I'm not plugged into a system like Northwestern immediately. I mean, I'm on Northwestern, but I'm not plugged in directly. And so I have to market for myself. And so now there's that marketing for myself and my business. And so, yeah, that's where we are today.
Well, definitely. I mean, you operate in so many different realms that we've always thought were just discordant, but they actually aren't. So
Mhm.
when you're in many different spaces and you start to really understand them, what are you learning about yourself, about practice, about business? What are you learning?
Ooh. Um, One is that we are all should try to continue to be teachable, to be humble and teachable. Okay, that we can learn new skills even in our mid career or later. That we can still do hard things, learn new hard things, and do them. And things are always hard in the beginning before they get to be kind of more natural. I learned to be a risk taker. We doctors are actually quite risk adverse, but we take risk in the operating room. We take risks with our patients, right? We make critical decisions that are risks every day that affect lives. But when it comes to ourselves, we're like, no, 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 it's a risk. It's a risk. So I learned to do that. I learned that um, authenticity is actually a welcome thing. Patients like that. At least it's working for me. That's all I can say. Okay. Like, I mean, patients want to see doctors be human. They want to know, like, I will use myself as an example for multiple different things. Like I deal with overactive bladder and I have tried medications and other things. And I have tell patients, yeah, da 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 about me. And they are like, wow, that just makes me feel more at ease. It makes them feel validated. It makes it helps them make a clear decision, and so not being vulnerable enough and authentic enough has worked well for me, and can be done in a way that really supports patient care, and that I learned that our impact and our voice has power even outside of the clinic walls. I get I get messages from people all over the world that have some issue that I've been like ranting and raving about and saying, thank you so much for talking about this and educating me. I talked to my doctor in Sweden, talked to my doctor in Australia, I talked to my doctor in, Nigeria and this, that, and, I'm starting to get help. Thank you. Thank you for, I get messages every match. I get a message from a matched individual. A few times it's from somebody that I remember speaking to. Sometimes it's from somebody I had no, like, complete stranger. Hey, Dr. Milhouse, I just want to let you know I'm matched in urology. I know you don't know me, but I know you. I first learned about urology and was interested in urology because of seeing you, because of your social media. Like that like puts a smile on my face. That makes all of the work and sweat worth it. Getting stuff like that. I had a primary care physician in another state who's been following me, who tells me now she prescribes vaginal estrogen routinely to her postmenopausal women with recurrent UTIs, vaginal dryness, dyspareunia, and she never did this before, and that she's helping patients, and she is incredibly, I mean, I get to, in doing this, I'm teaching people how to take better care of other people. It's not, it's incredibly rewarding. So, I'm very grateful for, um, the, I'm grateful for the opportunity and, for the passion and space to be able to do that.
I think you've really found your purpose. And I think you're seeing
Mhm.
now when you are aligned with your purpose and your passion and your energy, your voice goes from just treating that one patient in front of you to many. And
Mhm.
I'm really happy that you were able to make that jump and to make that transition and be vulnerable and figure it out. I think you're right. A lot of us really kind of play up our expertise in the field of medicine as surgeons, and
Mhm.
we lose the fact that we can and we do hard things, and other things are hard, but they're not the same type of hard, and we can do them also. And
Yes.
when you find what you're supposed to be doing, this is what happens. So thank you very much.
Thank you. I feel a tear like in the back. Thank you.
You are very,
When
very
you're like,
welcome.
I
Well,
think you found your purpose. Thank you. It's coming from you too, who I respect so greatly. So this has really been a pleasure. This conversation's, been so much fun and such a pleasure for me.
well, no, thank you. I think these real authentic conversations about how someone did it, what they gave up, the challenges, so that it's not always this high level, this is easy, this is how you did it, this is how I did it. No, it's really the nuts and bolts and the gritty and sometimes not as pleasant things that happen, but that's how you change the world. That's how you find your
Yeah.
happiness. At the end of days, we're going to look back and we're going to say, how do we spend our time? And you find that you're spending your time in your purpose, it's a much better life. So thank you very much, Dr. Milhouse, for spending your time and your expertise with us today.
You're very welcome. Thank you, Miles Thomas, for the great questions. And I hope you have a great rest of your evening.
Thank you. And thank you to our audience for joining us on the AUA Leadership and Business Podcast. Until next time, continue to learn, lead, and excel.
Thank you for listening. If you enjoyed this episode, make AUA Leadership in Business your go-to podcast. Subscribe today by searching AUA Leadership in Business on your favorite podcast app and enhance your leadership and business education needs.